We have with us today Frank Cousineau, who's the president of Cancer Control Society. I want to thank you and Lorraine and Norm Fritz and all the predecessors for what you folks have done for so many years for all of us involved in alternative medicine, and also for patients and people who are here trying to learn more about what's available out there and what really does work and what doesn't work, helping to kind of separate the apples and the lemons or whatever. And I'd just like to tell us a little bit about the Cancer Control Society, its history, what you currently are doing, and how people can get in contact with you as well. We'll finish up with that.
All right. Well, Dr. Rogers, thank you for having me. And
It's my pleasure.
Cancer Control Society actually started in 1973. Its predecessor was the International Association of Cancer Victims and Friends.
Exactly.
Cecile Hoffman, Dr. Ernesto Contreras Sr.'s very first Laetrile patient. And then Norman Fritz, Betty Lee Morales, John T. Clark, Lorraine Rosenthal got active in cancer victors, and then in 1973 decided that it was an appropriate time to start Cancer Control Society. And essentially what the Cancer Control Society does is provide and promote information and education on alternative therapies for cancer and other degenerative diseases. And of course, in your line of work, you know that, or we believe that natural approaches should be primary.
Absolutely.
And occasionally we recognize that some elements of conventional therapies may be necessary on a short-term basis.
Totally correct. I agree with it. I continue to practice elements of conventional as well as alternative. I have my foot in both worlds. And what I've tried to do in my practice for more than 30 years is gather the best modalities that work from alternative medicine and combine them with, when necessary, conventional medicine. And I totally agree with you.
And I think so many times people hear horror stories of conventional medicine and they want to just reject outright. Well, what we try to do at the Cancer Control Society is provide the information and the background, the foundation, so that individuals can decipher, can understand what these are. In other words, we promote education about alternative therapies because that's what we believe. And we do that a number of ways. The most important way we do that is with this annual convention, Labor Day weekend, here at Sheraton Universal in Universal City, near Los Angeles. And we have 3 days of live speakers, approximately 40 speakers, such as yourself. You'll be speaking with us this year. Very happy to have you. And some 30 plus others talking on different therapies, different tests, diagnostic, diets, all the things that go to make up a successful therapy, and things that patients can do on their own when they're at home, because they can only spend so much time at a clinic or with a doctor. And the other thing that we do, books, videos, journals, so that people can take them home, they can spend the time learning. And then we go to conferences. We go to professional conferences, A4M, the Anti-Aging, ACAM, the American Academy for Advancement in Medicine, and some of the other professional ones where we exhibit to reach out to physicians so that physicians can learn the same things that we're trying to teach the patients.
Excellent.
And then we go to other conferences for the general public where we provide this information to them and explain to them that we talk to physicians, and there's more and more physicians that are looking into these things or studying these things. And so we try to be in a position to network and to connect patients and the physicians that are doing the kind of things that you're doing, and the things in which we believe.
That's fantastic. That's exactly what the show is about. Educating the general public, not only in the United States but around the world, and also educating physicians so that they will have options. They'll know where to go, how to use them, what to do. And that's what we're really all about, is trying to get the message out to the general public and to the professional societies that there are other options out there. When everything else fails, don't give up. There are other ways to beat this disease. I had the privilege of knowing Betty Lee Morales and Norm Fritz, a good friend for many, many years, and some of the other founders, and I've been a speaker here, as you know, for many years.
Yes.
And it's just a pleasure to be able to speak with you today and have you here with us. What would you like to tell us about how people can directly get in contact with you, or anything else you'd like to tell us about Cancer Control Society, what it stands for, what it does?
Well, I think one of the primary things is that we're here to help the patient and the physician control cancer. I think people like you and me realize that cancer comes and goes. It's part of the natural process of living. It's if we get injured some way, cancer may develop, and it's part of the healing process. And if we do all the things that we're supposed to do, it disappears and we never even know that we have it.
Yeah, way back when I was in medical school, we were studying immunology with my best friend in medical school. I looked at what was going on, and I said, man, seems to me like probably most of us are going to get cancer one or more times in our life. And it appears that some of the latest data out there shows that's exactly true. What happens is our immune system is just strong enough to recognize these aberrant cells, these wild cell types, and kill them off. And when our immune system is depressed, when our body functions are depressed, then we come down with the disease. And it may be cancer, maybe something else. And Dr. Issels, who I had the privilege of working with the last several years of his life, also found this to be true. And he took, for example, some teeth that were pulled from root canal teeth and ground them up and injected, after autoclaving them, which is supposed to kill everything,
Yes.
injected them into a bunch of different lab animals and produced all sorts of diseases, not just cancers. Had many types of cancer, had arthritis, had rheumatism, had a whole bunch of other problems as well. So we really need to be enlightened to know what is out there, what we can do to make our bodies healthier. And it's not just limited to things that we typically hear about, like diet and exercising. Yes, those are foundational elements, but something as simple as dentistry. Dr. Kellogg, way back in Battle Creek, talked about that and had a dental facility at the Kellogg Sanitarium. And he recognized that because he was following the principles that Ellen White had written about and talked about, and she actually paid for his medical education. And he used those principles at Battle Creek Sanitarium, which is why he was so famous around the world. He had a dental facility right there in the Battle Creek San. And he recognized the importance of dentistry. Dr. Issels repeated it, and so many others. So there's many aspects to health, and I'm so thankful that you folks are here and that you're putting this stuff out there. I remember a few years back when Dr. Privatera was there and talking about dental health, and that there's so many different ways of approaching health. And it's just a blessing that you guys are here to be able to educate the public, to educate the physicians.
We appreciate you. We're glad to be here. And if your viewers want to get a hold of us, probably the easiest way is to go to cancercontrolsociety.com. cancercontrolsociety.com.
Wonderful. I've been able to help thousands of people reverse deadly disease. I can help you too.
Would like to point out one of the reasons that it's the Cancer Control Society is this what we just discussed, that cancer comes and goes.
Yeah.
And we have all these big charitable organizations that spend what appears
Billions
to be
of dollars.
most of their time raising funds.
Yeah.
To go out and raise more funds.
Yeah.
And they use the word cure all the time. This cure, race for the cure, walk for the cure, run for the cure, fly for the cure. And usually what it is die for the cure.
Yeah.
And
Amen to that
to
one.
me, cure is neither scientific nor medical. Cure is a legal term put into law by politicians that want to control people like you and me.
Yeah.
They define what cure is, and they define who can use the word cure. If cure were an effective word, you could take something for a cold and it would never come back.
Exactly.
All these conditions that they claim, we have cures for these things, they may alleviate the symptoms for a while, but as we know in time, they all come back.
Yeah.
And the same thing with cancer. If if somebody comes down, diagnosed with cancer, comes to you or one of the physicians like you that has worked at integrating the best of Western medicine with natural remedies, and the cancer goes away. If he goes back to doing what he was doing when he got it the first
Many times it'll come
cancer's
back.
coming back.
Yeah.
And an interesting situation I find, if it weren't so tragic, I think it would just be hysterical. Conventional oncology, Western oncology, says 5 years survival
Exactly.
is you're cured. Now, you could die the next day from the therapy or anything else, but you would be classified as
As
a
a cure.
clinical cure. Had a situation where a young man had a prostate cancer. All the doctors recommended surgery. It was well contained. Testicular cancer, but local, well-defined margins, and so the recommendation was just remove the
Excise it.
affected.
And they cured it.
And the doctor told him, he says, you know, the nice thing about testicular cancer is you don't have to wait 5 years to be cured. If 3 years, you're classified as a clinical cure. And then he says, but now, however, after that 3-year period and you've cured, there seems to be a high rate of recurrence. Now,
It's too funny.
how does a rational, educated person how can he say something like that is an illogic? It just
Not logical, doesn't make sense.
totally nonsense.
Yeah, it is.
And what we do is that's why I never use the word cure, because I know that if we do the things that cause the problem, it'll come back.
Yeah.
And that you can apply that to cardiovascular disease. You can look at diabetes,
Almost anything out there.
and I think diabetes is another thing. Pandemic, I mean, just horrible. But the interesting thing about it is it's a diagnosable disease, but so many of those people that come to one of doctors like you, they do some of the things you recommend, and dietary lifestyle changes. The diabetes disappears. It goes away. And so the doctor then, the conventional doctor says, okay, well, your diabetes has been cured. Well, no, it hasn't. It's the condition in your body that you established that caused, whether not utilizing insulin, whether it was you ruined your pancreas through improper lifestyle, is what manifested the symptoms. Now, you can change your lifestyle, supplement, you can do the things and control those, but if you go back to your old ways, whatever you had that was diagnosed diabetes is going to come back.
Yeah, that's why I tend also, like you, not to use the word cure. I prefer the term reverse or heal or any of those things. And if you change your diet, change your lifestyle, typically you can reverse most of the degenerative chronic conditions that are out there. Cancer, diabetes, heart disease are the 3 biggest problems we have right now. And by changing the way we live, by changing to a whole food plant-based diet, by doing the 8 principles of health that we know work so well, we really can reverse the problem, heal the condition, and the patients can live much better lives. Of course, if they go back to smoking, drinking, eating the fast food diets and all the rest of it, how can you expect not to get the same thing when the conditions are the same? And that's the reason why personally I believe that chemosurgery and radiation do really well one thing. They debulk the tumor. What they don't do well is cure the disease or heal the patient. The patients usually die, the vast majority of them. And that's because they don't change the conditions. If you don't change the conditions, the reason why the disease starts in the first place, how can you expect to have long-term results? You really can't. What you have to do is change the condition, change the reason why. Get to the heart of the problem rather than just trying to put a Band-Aid on it and treat the symptoms.
We agree completely on that.
Well, Frank, thank you so much for being here with us today. It's been a pleasure to have you. God bless you guys in your work. Please tell all of your colleagues associated with Cancer Control Society, we applaud them for their continued many years of labor. I know I've been doing this for over 30 years myself, And it's kind of an uphill battle. Not many docs were doing it when I started. Now I am so pleased to see a lot more doctors are getting involved, and it's because of groups like you and people like you that are getting the message out there. And it's also what we're trying to do with this show that we have, getting the message out there, not only to just the professionals, but the general public as well.
And we wish you well. Thank you very much.
Thank you, sir.
So,
Frank, could you tell us, in your experience, are you finding more doctors that are trained in Western-style medicine that are beginning to use more alternative, integrative approaches to treating disease?
Excellent question, and the answer is absolutely yes. Not only the greater numbers that are coming to Cancer Control Society convention that we get to see that come and say, I want to learn about this, but as we go to conferences around the country, we run into an increasing number of physicians that say, I never knew about these things. Thank you for being here. Can you help me? What else can I read? What else can I study? Where else can I learn how to integrate these principles with my practice?
Wonderful.
And the other thing is that we see is coming out of the medical schools, we see more young physicians willing to go against the trend and study nutrition on their own because they don't get too much.
You get basically nothing
In the university.
medical school. Yeah.
can you say that again? You started to say there are more young physicians.
There are more young physicians every year coming out of medical schools that see that conventional medicine just doesn't have all the answers, and they're taking the time to learn about health, nutrition, diet, and because we see them at our convention, our annual convention every year. They come and they tell us, gee, we never knew this, we didn't learn this in school, we want more information. We see them at the conferences, the professional ones that we attend. They come, they're hungry, they're thirsty for more knowledge and more information, and we're very happy to work with them.
And that's fabulous. And in medical school, we get virtually zero training in nutrition. Leave that up to the dietitians and the hospital nutritionists. And that's not something they train us, and it really should be. It's the basis for life.
It should be an integral part of any curriculum, from Hippocrates going back.
Yeah, more than 30 years ago when I first started working in alternative medicine, I was one of the very few docs out there doing it, and one of the very few docs here at Cancer Control Society and the prior one, Cancer Victims and Friends. And it's just a real pleasure to see so many physicians now joining the cause and coming on board. And initially I felt like a salmon swimming upstream, and it's just nice to finally have some colleagues that I can actually talk with, and they have a basis of knowledge to be able to discuss topics appropriately.
And there's a growing number to whom we can refer patients.
That's wonderful.
And that's what's
way back
what's really exciting.
for me, the ones I saw that had any interest at all were the young docs just coming out,
Yes.
or the older docs that already had 30 or 40 or 50 years, and they saw that the program for them wasn't working well anymore, and they were fed up with conventional medicine, and they said, hey, there's got to be something better. And so that's the ones that are taking the risk. But it's nice to see so many young docs now that are wanting to learn more about it in order to be able to have a continuing line of people that have education in these areas so that they really can integrate a healthier lifestyle. That's what we need. We have so many problems, especially in all these first world countries like America. And if you read Dr. Campbell's book, the problems that first world countries have, and if you change to a whole foods plant-based diet, you get rid of most of them.
That's true.
Well, Frank, thank you so much for being here with us today. It's been
Thank
a
you.
pleasure to have you. God bless you guys at your work. Please tell all of your colleagues associated with Cancer Control Society, we applaud them for their continued many years of labor. I know I've been doing this for over 30 years myself, and it's kind of an uphill battle. Not many docs were doing it when I started. Now I am so pleased to see a lot more doctors are getting involved, and it's because of groups like you and people like you that are getting the message out there. And it's also what we're trying to do with this show that we have, getting the message out there, not only to just the professionals, but the general public as well.
And we wish you well. Thank you very much.
Thank you, sir. You have the right to make your own choices about your health.